Hello everybody, I'm Dr. Aamir Abbas and I'm here to talk to you about the scope of your research question. And this is the second lecture in the series of lectures in which we are talking about how to formulate a research question. The objective of this presentation is to understand the words used to specify scope of the research question. The scope of the research question is specified by a few words or their meanings, and these include words like incidence, prevalence, therapy, screening, diagnosis, prognosis, harm, etiology, and prevention. These words might be self-explanatory, but their understanding is important because they are critical to specifying methods for executing your study. So we are going to define each one of them. Incidence is defined as incidence proportion is the proportion of an initially disease-free population that develops disease, becomes injured, or dies during a specified, usually limited period of time. Examples of research question including incidence are, for example, what is the incidence of pulmonary tuberculosis in Pakistani population? What is the incidence of low birth weight among rural population as compared to the urban population? How many new cases of borderline personality disorder were diagnosed last year in the outpatient psychiatric clinic of Hospital X? So either the word incidence is directly used or some other words like newly diagnosed cases or similar words which convey the same concept is used. Similarly, prevalence is defined as the proportion of persons in a population who have a particular disease or attribute as at a specified point in time or over a specified period of time. Examples of research questions involving prevalence include what is the prevalence of pulmonary tuberculosis in Pakistani population? What is the prevalence of low birth weight among rural population in India? Therapy is a self-explanatory term meaning that we want to see whether there is a benefit of giving a medicine or any other type of treatment for a particular condition. Similarly, the word screening is used to look for a disease when a person does not have symptoms. On the other hand, diagnosis is defined as the art of or act of identifying a disease from its signs and symptoms. We define prognosis as forecast of probable course and outcome of an attack or disease and the prospect of recovery as indicated by nature of the disease and symptoms of the case. Similarly, harm can be defined as harm is a self-explanatory word used for talking about any unwanted result of a treatment or any other medical procedure. Etiology is to know the cause of a particular condition, and prevention is to keep off something such as illness or injury from happening. So if any of these words is used in the stem of the research question, they are specifying the scope of the research question, and these words have their methodological implications, and we need to be very much cognizant and mindful of using these words properly, and we also need to be clear that these words have usage of these words have some study design implications which we will talk about in the future videos. If you have any feedback or questions, you can write to me on this email. I will encourage you people to give me feedback because that includes the quality of these videos. Thank you very much. Bye bye.